So my name is Darcy Aslett. I'm a pharmacist. I work for St. Luke's Health System in Boise, Idaho. My job title, I have two right now. I'm the residency program director for our PGY1 community-based residents in our health system. And then I'm also the clinical pharmacy services coordinator for community pharmacy. So I help to lead programs that help push the scope of practice for pharmacists in the community pharmacy setting. What was the last part?
Just how long have you worked there?
Sure, I just hit 10 years. So that's super exciting. This June is my 10-year anniversary. So
Nice. What does an average day in the life look like for you as a pharmacist?
sure. So my job is a little different than maybe what you would view as a typical pharmacist. Do you want me to talk about my job in more of a leadership role or jobs within the scope of pharmacy as a practice?
Either way, maybe start with like pharmacy as a practice and then like where
Sure.
you are now.
Yeah. So I can talk about life as a community pharmacist. So a lot of people, when they think about community pharmacy, they don't know what it means because we don't use that word a lot. But community pharmacists can be in a variety of settings. So I'm a community pharmacist in a health system. There's also like independent pharmacies and also, of course, retail pharmacies. So these are pharmacists that provide medications, like dispense medications, as well as counsel patients on over-the-counter items and catch drug-drug interactions all the time. So we are probably the most public-facing pharmacist available, but there are tons of other pharmacy jobs besides the one that I have, which is a community pharmacist. So in leadership, it's probably really similar to other jobs as you get into leadership. My day consists of several meetings, and that can involve people more senior than me. It can also involve peers and people that I collaborate with across the health system. So I work with our operational team a lot, and I also work with different health professionals. Working in a health system kind of gives you that ability to cross collaborate with a variety of professionals. So like I'll present to a panel of physicians and pharmacists and nurses on certain protocols that we might want pushed forward. And then I'll have a meeting with one of my residents. So it's just kind of the day is sporadic, meeting with lots of different people across the health system. But as a community pharmacist, you spend the day very, very busy. It's such a fun day. I love being a community pharmacist. So you are just handling a lot of different things at any given time. You might have a mom who is very worried about her child who needs assistance right away, like help me dose this Tylenol, or you might have a patient in need of a particular medication and the prior authorization is waiting, so you're navigating that situation. New starts on all medications, answering phone calls, answering technician questions, calls from physicians' offices and nurses. It's a very, very busy job, but I've absolutely loved it. When I was working in direct patient care, it was so fun for me.
That's great. When did you first know that you were interested in sort of what you do now, or were you initially like, did you think you were interested in something else and wanting to go a different way, or like, how did that play out?
I have been through so many paths. So I went to pharmacy school late. I started in college at 18 and I thought I wanted to be an engineer. So I started in, I think it was electrical engineering. Then I moved to chemical engineering. And then I finally moved to chemistry. And during that time, a lot of what deterred me, to be totally honest, so this is super cool that you're doing it, is, this was several years ago. So lots of women just weren't in those fields yet. And I felt a little isolated. I was like the only, female amongst many males. And it just was I didn't like that. I'm super social. I wanted to have some female colleagues, I guess. And I think once I had gotten into the workplace, it would have been just fine. But I just ended up going down the path of chemistry. And then I taught for a few years. I taught at Boise State. And during that time, I had to kind of figure out what my next move was. So was it going to be graduate school in chemistry, or was it going to be some kind of medical graduate field? And I did do some research in a couple of different medical fields. I just landed on pharmacy. It just made the most sense for me at the time in my life. I was 28 when I went back to school. And I really like science, and I really like conversing with people. I like talking to people and educating people. I've been in education for 5 years. And I don't love palpating or touching people or the bodily fluids that are associated with healthcare. So to me, pharmacy just made the most sense. It's super like lots of numbers, lots of calculations, lots of math, lots of biochemistry and physiology. And to me, that part was like super, super cool. And then you incorporate the patient aspect, and I just really liked the whole idea. And I really enjoyed pharmacy school.
That's cool. Where was your like first job as a pharmacist? Was it St. Luke's or something else?
No, I worked right out of the gate. I worked for Albertsons as a float pharmacist. I would go to several stores a week, wherever they needed me, and I would cover. And I learned so much that first year. So I didn't do a residency right out of college, right out of pharmacy school. Right now, there are several opportunities to do so. So it's called the Post-Year 1 Graduate Program, which is what now I'm the director of at St. Luke's for community folks. But so after you graduate, you do have the option to go right into practice right after that first year. And I chose retail. I really liked it. It was a really different scene back then when I graduated in 2012. And since then, there have been several changes to the retail pharmacy scene that have made it less desirable for several pharmacists, but some really still love it. The payer aspects have changed and such, and so the staffing models have changed. But at the time, it was awesome, and I learned so much. I was just, learning on the job literally every single day. And drinking from a fire hose and trying to apply my clinical knowledge within this really fast-paced environment. But so when I started to get a little more serious about my work-life balance and what I needed to do to kind of help adjust that, I looked to Luke's for that, and it's just been a good opportunity. The organization working for Luke's is amazing. I don't know how many other people you've interviewed from Luke's, but it's a great organization for career development. So I started as a staff pharmacist. I was doing that for several years and came into different roles, and then eventually ended up in leadership through just the progression of my career.
Cool. What advice would you give to someone interested in becoming a pharmacist?
Yeah, so I think if you want to become a pharmacist, you're just start doing what you're doing, start talking to pharmacists and asking what they do. I think if you are considering pharmacy, you're probably considering other healthcare professions, and being able to differentiate those through the day-to-day work, I think is really important. Pharmacy as a profession is shift work, and so you have to be willing to do things like work holidays and deliver patient care when it's needed. So that comes into play, but that's really all of healthcare at this point, so being prepared for that. I also think that, you do have to have a passion for taking care of people. So that's super important. And then beyond that, all the science is really important, and knowing that you can, produce accurate values when you're doing calculations is super important. I also think if you've narrowed it down and you're like, okay, pharmacy is it for me, it's super important to start thinking about like the different varieties of pharmacy that you can practice, because they're so vast. So again, I think people think, you're in pharmacy sitting in a desk at the hospital doing acute care, or you're behind the the counter at a retail pharmacy setting. Like those are the two, but there's so many things in between. And now where we have specialty medications coming up, there's a lot of PBM work that can be done. We have ambulatory care pharmacists embedded in clinics. We have a lot of pharmacists that go on to work for industry. And then, of course, we have the retail side and the acute care side and specialties upon that. So emergency medicine pharmacists, as well as oncology pharmacists. So kind of as you enter into the pharmacy world and you start to it's important that you do differentiate those several options. But yeah, I would just start talking to pharmacists and try to get a feel for their day-to-day and see if that's something that you would like. I was able to shadow pharmacists. Like this was in the olden days, Valen. So this is like 2007. And so pharmacists would let me into like the retail pharmacy space. And I also went into some acute care spaces. And now you really have to, it's a lot more formal, where you have to dot a lot of I's, cross, they don't just let anybody walk in and start observing. So, but in the olden days they did. And so I was able to get to see the day-to-day, and what I observed as like a patient from the floor is really different than what goes on behind the counter, and in the seat of an inpatient pharmacist. So
got it. Yeah, I think that's definitely sounds valuable to be able to like see what goes on day to day. But what is your favorite part about your job now?
Right now, my favorite part is developing residents. So I bring on 3 new residents each year, and we work on projects together. We work on their development. They're independent pharmacists, so they're fully licensed, but they are still learning a lot. We work on their leadership skills. We work on their ability to navigate and lead projects. We work on their clinical knowledge, and their teaching skills. So that is just really awesome to see every single year, year after year, bringing in a new group of residents fresh out of pharmacy school and developing them into professionals, where they can really go do any kind of field of pharmacy that they want to do, really. So that's by far my most rewarding. As a community pharmacist, my most rewarding part was just that daily interaction that I would have with patients every day. And helping to troubleshoot problems for them and just improve the quality of their life from a very, honestly, from a pretty simple level. So.
Yeah, for sure. When you were a community pharmacist, were you doing like a lot of chemistry, a lot of math, like day to day, or I guess like how often were you using that sort of thing? Because you said you were like studying chemistry.
Yeah, my undergrad was in chemistry and math, and I just, when I was looking for graduate schools, I knew I couldn't be in a lab because I'm way too social. So, and I mean, that's the option, right? Like you either go medical or you go graduate school. At least when I was, again, 100 years ago, when I was in school, that was kind of the option. In terms of day to day, it's calculations that you do daily. They're like during pharmacy school, it's super challenging because you're doing all the calculations, right? So yeah, there's a ton of math involved. There's a lot of biochemistry, and there's a lot of physiology and pathophysiology. So you have to like just baseline, you have to know how to do that. And then for your boards, you have to know all of it as well. So you take your boards, you have to reproduce what you've learned in pharmacy school, be able to do those calculations. But when you get into like your job, you're mostly doing like weight-based calculations, dosage adjustments based on kidney and liver function. And so the math is less intense, I would say, day to day. And that probably goes for your because it doesn't matter what setting you're in, you're doing these calculations based on drug dosing. I think there are some subspecialties of pharmacy. I would say probably oncology that might be a little more like heavy on the math when you get out and you're actually working on that, because those drugs are so, you have to be very, very careful with all those medications as you're administering them. So that's probably going to be a little heavier. But again, it's going to be calculations you do every day where, you know, you're not like learning a new math skill every single day. You're just, these are things you get used to and you do every single day.
Yeah. Okay.
Yeah.
What skills do you think you need to be a pharmacist, or like what are certain skills that if you saw it in somebody you would think, oh, you'd be great at this, or like
Yeah.
you wouldn't be great at this, I guess.
Yeah, I think attention to detail is probably the most one of the most important ones. I mean, okay, like you have to be able to want to take care of patients. Like this is just baseline characteristics, no matter what healthcare field you go into. You have to have that desire. Otherwise, you're going to burn out and not like the job. So if you don't have the initial like, I want to do this, I want to take care of people, I just wouldn't recommend it because it will burn you out really quick. But besides that, like skill level, yeah, really strong math skills, really strong, having a good background in physiology, as well as biochemistry and, you know, chemistry, because that complements, but, and being able to, you know, calculate fairly easily. Like if numbers are hard, you know, challenging. Now, we have pharmacists out there who will say, I was terrible at math in like elementary school, but for whatever reason, they developed into pharmacists. And I've talked to a couple of those and I'm like, how did you get through pharmacy school? And so they figured it out, right? Like they figured out how to do these calculations. But then when you get into your job, attention to detail is huge because you're off by like a decimal point, and that's a huge deal for patient care in a lot of situations. Or, you know, you're, let's say like an AmCare pharmacist and you're reading a note and you're trying to gather history and you miss a detail, you know, from that previous note, and you haven't seen this patient before. That's a really important detail. So like you have to be a good reader, you have to be very focused on attention to detail. I mean, I always say organizational skills are huge in the residents that I'm seeking, but that's because they're navigating so many different projects at any given time. And I just think like, you know, to get through pharmacy school in general, you have to be pretty self-motivated because it's an additional 4 years of education. So, you know, you can get your undergrad, and some people do pre-pharmacy where it's like 2 years and then they can get right into pharmacy school. It just depends on how competitive it is to get into pharmacy school that particular year. But yeah, I mean, you have to stay motivated. Like 4 additional years of schooling is a lot, you know? So, but if you already have the mindset, like, you know, you're going to do more school, it's not as bad. Once you get in, you get with your cohort and meet friends, and it's totally fine then. You're just broke.
What do you think are the most common misconceptions that you get about your job from others?
I think that particularly retail pharmacists, and I don't just think this, there's data to support this. I mean, you know, I was sitting at the pharmacy, this was just this last October, because St. Luke's didn't have the COVID vaccine quite yet, because all the ACIP it was a hot mess. So anyway, we were trying to figure out guidelines around the new incoming COVID vaccines and the new guidelines coming out from the government. So we didn't have those yet. Our legal team was reviewing, but I wanted the COVID vaccine. So I went over to Albertsons and I was just sitting there, and I remember this pharmacist was so busy. It was Saturday, several people waiting in line for flu COVID vaccines, maybe like a UTI consult as well. And you know, like there was a woman and her daughter sitting next to me, and the woman was like, they're just super overqualified for this job. Like these people go to school for so long and then they sit here and count pills all day. And, you know, and I was like, gosh, what a misconception. So, you know, we definitely count pills, at least in the community setting, although we're moving much closer to AI assisted like models and like dispensing and that kind of thing. Big machines that count for you, and, you know, just strictly looking at the clinical picture for the pharmacist is doing, and having technicians focus more on that. but you never get away from the product. So you always have to be able to dispense the product out. Like that's very important. If you go to the pharmacy, you expect to get a medication. And if you don't have that in hand, that's kind of a problem. So I think people think that because we're providing, it's almost like a transactional experience that, we've gone to school for a long time, and us providing you with this product like you would in any other retail setting would kind of diminish. It kind of diminishes it a little bit. But the fact is, like, it is a transaction, but it's also a clinical service that you're providing on top of it. And so I think that's probably the biggest misconception. I always say, like, we're just really friendly people that have a lot of knowledge to share with you. So we're well educated and we want to help you. So, but we do have a lot of knowledge. And so I think that kind of hurts my heart a little bit when I hear those comments, because like, I know she's working extremely hard behind the counter. And part of the retail model, that's part of what some of the retail model needs to address. Honestly, as a nation, we need to just kind of get that figured out, because the current retail model is not super sustainable right now. But yeah, I mean, I think understanding that pharmacists have as much, graduate education as physicians, and some have lots of postgraduate education as well, and just understanding that pharmacists have a high level of education as well. I think it's super important.
Yeah, I think that's good for people to know for sure.
Yeah.
Next question. Do you have any big regrets, or are you pretty happy with where your career path ended up taking you and like the direction that you ended up going?
I'm super happy. I love this job. I also made the decision a little later, I mean, I didn't really know what I wanted when I got my undergraduate. And so I just worked, and that was really good for me too. I think, I selected pharmacy for a variety of reasons, but the path that I've selected has been really great because it's opened up so many different possibilities. So I think I generally am not a person that has a lot of regrets anyway. So I think that's part of my personality. But I've also just said yes to a lot of opportunities and been willing to kind of jump in, and not feeling always 100% able to. I don't know if I'm fully prepared for this, but I'm pretty sure I can figure it out. And that's kind of the point that I'm at in my life. But yeah, I would say no regrets. Sometimes I wish I had decided that a little earlier, but those years that I was kind of going through it and figuring it out were super important as well, in shaping what I wanted to do. So yeah, my husband and I always talk, and like, he's like knew what he wanted to do from the time he was 16, and I never had that. But I think there's a lot of joy in just finding the path as well, like just going down that path. So no regrets.
Yeah, I think it's fun kind of knowing there's so many opportunities, and like you, like, I don't know, even though I don't know exactly what I want to do, I'll figure it out. And same with like other high school girls who maybe they do know what they want to do. Like, it's never set in stone, but
yeah, it never is. And sometimes if things change all the time, our residents come in, our new grads come in, and they know they want to be AmCare pharmacists. And then they start getting into some of these different fields of pharmacy, and they're like, I actually love specialty, or I loved my PBM rotation. And so you just, honestly, you don't know what you don't know. And so until you kind of start getting out there and testing a few things, and eliminating things, honestly, where you're like, I definitely don't want to do that, but yeah, I think it sounds like you're on a really good track, and you're already so far ahead of the game. You're way ahead where I was. So I think you're doing great, Maylin.
Thank you. Well, my final question is, what is your biggest piece of advice that you would give to a high school girl looking for next steps, or like trying to find what she's passionate about, or like what's one thing that you wish somebody told you when you were in high school?
Great question. This is the hardest question. Yeah. I don't really have, again, I'm not like a big regret person, so I don't kind of go back. I don't go back in my life a lot and say, gosh, I wish somebody had said that, this or that. yeah, just can't. I know that I've said this, but I would continue to be open-minded. I think again, you go in so certain that not you, several women your age go in so certain of things that they want to do, and then you get to the reality of it, and it's just not what you thought, or you may not um, find that it fulfills you as you wanted it to. And I would just say it's totally fine to change your mind. Like don't feel like you're so dug in, even if you're like a couple of years into your career postgraduate, like there's always time to pivot. And my husband and I always say, like, gosh, people live so long now that you really can have like 2 or 3 pretty separate careers in your life. And, so if something's really not working for you, never get to the point where you're like, it's too late. That's just, I think, I mean, unless you're like 75, maybe then. But like, if you're young, if you're in your 20s or even 30s and you want to do a pivot, you totally can.